Choosing a dewormer for your cat, Drontal versus Panacur. But one of these vet staples is FDA approved for cats, while the other is technically used off-label. So why would veterinarians so commonly prescribe an off-label medication for felines? Because Panacur treats Giardia, a nasty protozoan causing chronic diarrhea that Drontal doesn't touch. In this video, we'll break down their target parasites, dosing, and safety to help you make the best choice. Let's begin with the core function. Which worms does each dewormer actually kill? Drontal is your specialist for the big three common intestinal worms. It effectively eliminates tapeworms, roundworms, and hookworms. Panacur covers roundworms and hookworms too, but its spectrum is wider. It adds whipworms, lungworms, and Giardia to its list. Think of Drontal as a targeted tool and Panacur as a broad-spectrum solution. This difference is key. So if Panacur covers more parasites, why isn't it the default choice? The answer is in its practical application. And that regulatory status? Drontal's specific FDA approval makes it a clear, on-label choice for the parasites it covers. To understand their different targets, you have to know their mechanisms. Their killing methods are fundamentally different. Drontal's ingredients work by paralyzing the worms. The parasite loses its grip on the intestinal wall and is then passed or digested. Panacur, on the other hand, starves parasites. It blocks their energy production, causing them to die over several days. This difference in mechanism directly impacts how you give the medicine. Let's look at dosing and administration. Drontal is typically a one-and-done treatment, a single tablet. Panacur requires a multi-day course, usually 3 to 5 consecutive days. Drontal is a tablet, which can be tough. Panacur offers granules or liquid to mix into food, a huge advantage for picky cats. Scenario 1. Your cat gets fleas and you later see rice-like segments. This is classic tapeworm. A single dose of Drontal is the efficient fix. This answers our earlier question. For a simple tapeworm case, why give 5 days of medicine when one targeted dose works? Scenario 2. A rescue kitten has persistent soft stool that hasn't responded to other treatments. Your vet suspects Giardia. Panacur is the clear choice. Giardia is a microscopic protozoan, not a worm. Drontal's worm-paralyzing action doesn't affect it. Panacur's energy blocking is required. The right medication also depends on the cat itself. Now for safety, especially for kittens and pregnant cats, age is a major factor. Panacur is generally safe for kittens as young as 2 weeks. Drontal is for kittens 8 weeks and older and over 2 pounds. And for pregnant queens, both medications are generally considered safe, but this always requires strict veterinary supervision. A serious warning: never use Drontal Plus on a cat. It's formulated for dogs and contains an extra ingredient harmful to felines. One more point. If you use Drontal for tapeworms, you must also treat for fleas. Fleas carry tapeworm eggs, ensuring rapid reinfection. With different worms, hidden parasites, and varying symptoms, how can you possibly know what's infecting your cat? The answer is, you can't, not by yourself. Guessing is not a strategy. The only way to know is a veterinary fecal exam. Symptoms like diarrhea or even visible worms are just clues. Many parasitic eggs are microscopic. A fecal test provides the diagnosis, and the tapeworm-flea connection reveals a larger truth. Dewormers are only one part of the solution. Prevention is another. So the choice between Drontal and Panacur isn't about which is better. It's about which is correct based on a specific diagnosis. To review, Drontal is the FDA-approved single-dose specialist for common tapeworms, roundworms, and hookworms. Panacur is the broad-spectrum, multi-day choice for treating tougher parasites like Giardia, whipworms, and lungworms. The most powerful tool you have isn't a pill, it's a diagnosis. A simple fecal exam removes the guesswork and ensures correct treatment. Don't guess with your cat's health. Partner with your veterinarian, get a definitive diagnosis, and create a targeted deworming plan.